everyone, I'm Abbie Tipler and I'm one of the surgeons at Veterinary Specialist Services. Today we're going to be discussing the conservative management options for osteoarthritis. So I hope that this helps with some of the patients that you're treating at the moment. If you have any questions about this talk, which is in the vet resource area of our website, then please don't hesitate to give us a call. I hope to chat to you soon and we'll get started talking about osteoarthritis. So we're going to discuss a little bit about the conservative management options for osteoarthritis. So degenerative joint disease is common and it occurs in 30 to 50% of dogs and 90% of cats. And it's often secondary to underlying causes, for example, hip dysplasia, elbow dysplasia, cruciate ligament disease, or a previous episode of trauma. And although it results in a painful and debilitating degenerative joint disease, there are some excellent management options. The symptoms of osteoarthritis are pain, limping or stiffness, especially after rest or exercise, difficulty getting up and down, difficulty with stairs or jumping in and out of the car, reluctance to exercise or play, and sometimes altered behaviour, including aggression. So before the initiation of treatment for osteoarthritis, we need to get an accurate diagnosis. And there are some other conditions that can present similarly to osteoarthritis, and these include septic arthritis, immune-mediated arthritic disease, or things like intervertebral disc disease, for which the treatment can be different. So our diagnosis is generally based upon our physical examination, imaging, blood test results, and joint fluid analysis. And there's many imaging techniques available, including radiography, CT, MRI, and ultrasound. But radiographs are probably the most commonly used technique, and typical radiographic changes include osteophytes or new bone formation around the joint, joint effusion, and muscle wastage. No single treatment is effective in every patient, and adjustment of the treatment regime can be performed for every patient on an individual basis. But our ultimate goal is to help a pet live a pain-free life. So in some cases, surgery may be an option. It may be recommended to stabilize an unstable joint, to fuse a joint or combination of joints, or perhaps to replace the joint entirely in severely affected patients and depending on the joint. And the details of these advanced surgical options, if available, will always be provided. And recommendations will vary according to the joint affected, the degree of osteoarthritis, and the evidence for the various surgical procedures on offer. In terms of medical management, one of the mainstays is analgesia or pain relief. And there are several different options, but there are two that we very commonly use. The first are called non-steroidal anti-inflammatories. And these drugs are the most commonly used of all treatments for osteoarthritis. And they act to inhibit the inflammatory enzymes that can lead to pain and inflammation. They are very effective, however, they do not reverse or repair any of the joint damage. And should a non-steroidal anti-inflammatory drug be initiated for long-term use, a baseline blood will usually be recommended to check that your pet is systemically well and able to tolerate the drug. And although severe side effects are uncommon and they're generally well tolerated, kidney and liver toxicity have been reported. Ulceration of the gastrointestinal tract is also an uncommon side effect. And ongoing, we recommend serial blood checks every 3 to 6 months just to monitor liver and kidney enzymes and general health. Gabapentin is the second drug, and this acts at the level of the spinal cord to reduce chronic pain, particularly of neuropathic origin. And it is very effective when combined with other analgesics, for example, the non-steroidal anti-inflammatories, as we've just discussed. The possible side effects of gabapentin include mild sedation, occasional diarrhea, and uncommonly ataxia, which is a wobbliness. Sedation can be minimized by tapering from a smaller starting dose and then increasing to the desired dose. And conversely, when stopping the drug, it's best to taper from the current dose to a smaller dose over a period of a couple of weeks to avoid any reflex pain from coming off the gabapentin. Prescription diets are another conservative option for the management of osteoarthritis. So diets such as Hills JD and Royal Canin Mobility contain higher levels of essential fatty acids. Essential fatty acids are components of cell membranes that are involved in lipid transport, and they serve as precursors for hormones that regulate inflammation. Diets high in fish also contain higher levels of omega-3 fatty acids. And there's some evidence that diets high in omega-3 fatty acids reduce the DNA coding levels for enzymes that degrade cartilage and inflammatory cytokines. In one study looking at dogs with osteoarthritis, fed a control diet versus a diet high in omega-3 fatty acids revealed reduced lameness on objective force plate analysis. New Zealand green lip mussels have a composition of glycoaminoglycans, omega-3 fatty acids, amino acids, vitamins and minerals. And the suggestion has been that these nutrients act synergistically to reduce inflammation, limit cartilage breakdown and support the regeneration of cartilage. There may be an improvement in lameness scores and pain for dogs with osteoarthritis. However, the evidence is limited and it's difficult to make really firm recommendations. But it is available in a formulation called Antinil, and that's available online. In terms of the other nutraceuticals, unfortunately there's a limited number of controlled clinical trials, so it's difficult to make really firm recommendations about the various nutraceutical supplements that are available. So in terms of platelet-rich plasma, there is some evidence that injection of platelet-rich plasma into joints with osteoarthritis improves lameness scores. And these studies generally looked at lameness scores in patients around 3 months post-injection. Our experience with platelet-rich plasma is that it provides some relief for around 6 months, at which point repeat injections are required to maintain the results that are seen. Platelet-rich plasma injections involve a general anesthesia and collection of blood from the patient, which is then filtered to obtain a platelet-rich plasma which is injected into the joint. In terms of ongoing management, balanced exercise is really important. And in the period after an acute flare-up of osteoarthritic pain, it's advisable to keep your pet rested for a period of days just to allow this acute inflammation to settle. And then when we introduce exercise again, it should be very gradually to return to a normal exercise regime. So exercise, however, is of extreme importance when it comes to the management of osteoarthritis. Weight bearing itself is essential for cartilage to produce joint fluid, which is essential for joint health. Muscles also act as a sling for the joints, so when the muscle mass becomes reduced through pain or disuse, there may be more pressure on the joints during movement. And individual pets will tolerate different amounts of exercise, and this should be assessed by the owner on a day-to-day basis. So make changes to an exercise protocol very gradually, and if a patient is lame the day after a heavy period of exercise, then this may be an indication just to reduce that exercise quantity a little bit. Some simple tips for exercising an osteoarthritic pet are that long and slow is better than short and fast. So for example, a gentle walk for 30 to 60 minutes on the lead is better than allowing unrestrained off-leash activity. Low impact surfaces such as grass and sand, which encourage more range of motion, are preferable to hard pavements. Swimming is a really great low impact exercise, and how to correctly swim a dog is something that's best discussed with a physiotherapist. And then modify the amount of exercise depending on how it's tolerated. Our physiotherapist at Veterinary Specialist Services is Lindsay Connell, and she's a world leader in animal physiotherapy. And she's one of the most experienced animal physiotherapists in Australia, and we're extremely fortunate to have her working with us. She can create a tailored physiotherapy plan depending on the joints involved and the muscle wastage that may have resulted from the osteoarthritis. And weight management, although this is being mentioned further down the list, it is actually the single most important aspect in the successful management of osteoarthritis. So in the osteoarthritic patient, being overweight is a serious problem, and every extra kilogram the dog carries is putting extra strain on an already damaged joint. Any exercise that is undertaken while the dog is overweight further increases this strain. So during the initial period of exercising a dog with osteoarthritis, we recommend that strict dieting accompanies lead exercise only, and this can gradually be increased as the dog reaches their ideal body condition. So in summary, the management of osteoarthritis is a day-to-day business and there's no magic cure, but there's lots of strategies that can help. Often owners become experts in manipulating their dog's diet and exercise so that dogs can live a happy and moderately active lifestyle. Thank you for listening to this summary on the conservative management options for osteoarthritis.